Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see classification number 17, and that is nothing but the drugs used in the treatment of angina pectoris and also drugs used in the congestive cardiac failure or congestive heart failure. We have already seen 16 classifications. If anybody has not seen those videos, please go in the channel's playlist and watch all the previous videos. So this classification, believe me, it is very important for your GPAT Niper DI Pharmacist exam. So it's my request to you, please watch this video until end. Drugs used in the treatment of angina pectoris, drugs used in the treatment of congestive cardiac failure. So I am going to explain you in a very short regarding this. My dear friends, first of all, you should know what do you mean by angina pectoris or anginal pain simply. So what is angina pectoris or anginal pain? So your heart is doing work all the time. Your heart is beating all the time. It is continuously beating. So your heart also needs some energy. Your heart also needs oxygen, nutrition and energy. Oxygen, nutrition and energy to your heart is supplied by blood through this coronary artery. Now blood flow to your heart muscles or blood flow to the myocardium of your heart, that is via coronary artery. This is the only artery which supplies the blood to heart. And now if there is any blockage in this artery, so as you can see in this image, this one is a normal artery, coronary artery. There is no blockage, so this normal artery is able to supply the blood to your heart as per the demand of your heart. Now if there is any blockage, if there is any deposition of fatty layer, if there is a deposition of cholesterol in the artery known as a arteriosclerotic plaque, it is known as a arteriosclerotic plaque as you can see in this diagram. So it is a blocked artery. So if there is a deposition of arteriosclerotic plaque in the artery, now there is a decreased lumen, decreased diameter of this artery, right? Now this artery is not able to supply the sufficient blood to your heart. Now if there is a blocked artery, so it will not supply sufficient blood to your heart. Now if you are not doing any work, if you are at a rest, अगर आप कुछ काम नहीं करो, आपका हार्ट क्या है, रेस्ट में है, so at that time this blocked artery also able to supply a small amount of blood to your heart, which is sufficient during the rest. But if there is a working state, if there is a stress, at that condition your heart needs more blood supply, and this blocked artery is not able to supply sufficient blood to your heart, and at that time you will develop anginal pain. So what is angina pectoris basically? So angina pectoris is nothing but a kind of disease. It is a disease of your heart where there is a decreased oxygen supply as compared to increased oxygen demand of your heart. So there is an imbalance between demand and supply of oxygen via blood. That is known as angina, okay, or anginal pain in a short. Now this anginal pain, you develop this anginal pain originate from your heart. Anginal pain originate from your heart and it get referred. It is a kind of visceral pain. ये पेन visceral pain होता है and it originate from your heart and it is referred to your left side of your body. So it referred to your left arm, left back. तो आपको anginal pain जब होगा तो आपका पूरा जो लेफ्ट साइड है, जो लेफ्ट साइड का आपका आर्म है, उसमें आपको ये पेन फील होगा. लेफ्ट साइड का बैक जो है आपका, उसमें भी आपको ये पेन फील होगा. So that is the angina pectoris. There are different types of angina. There are different causes of angina. One of the most important causes is nothing but the blockage of coronary artery or arteriosclerotic plaque, right? That is the most common cause. There are other reasons also. For example, extreme emotional condition. जैसे होता है कि आप बहुत किसी से प्यार करते हो, बहुत ज्यादा प्यार करते हो, मैं उसके बिना जी नहीं सकता, और उसका क्या हो गया, उसका देहांत हो गया या फिर वो मर गया. सो ये क्या होगा, आपको इमोशनल ट्रॉमा होगा, इमोशनल शॉक होगा. सो इन दैट कंडीशन व्हाट हैपेंस, your coronary artery get constricted, spasm of coronary artery. So at that time also you will feel anginal pain. या फिर एक्सट्रीम कोल्ड कंडीशन, जहाँ पे बहुत ज्यादा कोल्ड कंडीशन है, जैसे आप लद्दाख में गए, वहां पे कोल्ड होता है जहाँ, वहां पे भी आपका कोरोनरी स्पाज्म हो सकता है। या फिर आप बहुत ही ज्यादा खुश हो गए, सो एक्सट्रीम हैप्पीनेस, एक्सट्रीम इमोशन, बहुत ज्यादा हैप्पी हो गए, उस टाइप पे भी आपको ये स्पाज्म हो सकता है कोरोनरी। या फिर आपको बहुत ज्यादा एक्सरसाइज कर रहे हो, उस टाइम पे भी स्पाज्म हो सकता है। देयर आर डिफरेंट रीजन फॉर एंजाइना पेक्टोरिस। व्हाट आर द टाइप्स ऑफ एंजाइना पेक्टोरिस? Types of angina. First type is nothing but the classical angina or stable or exertional angina. So it is the most common form of angina pectoris. It is also known as angina with efforts, and it is produced by unusual physical exercise. तो आपने न्यूज में देखा होगा कि कोई एक्टर है, वो एक्सरसाइज करते करते ट्रेडमिल पे रनिंग करते करते कोलैप्स हो गया या फिर गिर पड़ा। दैट इज ड्यू टू दिस क्लासिकल अंजना और स्टेबल और एक्सर्शनल अंजना और अंजना विद एफर्ट। बेसिकली होता क्या है उसमें कि उसमें जो कोरोनरी आर्टरी होता है, उसका कोरोनरी आर्टरी में क्या होता है, डिपोजिशन होता है ये फैटी टिश्यू का और फैटी एसिड्स का या फिर कोलेस्ट्रॉल का। सो देयर इज डिपोजिशन ऑफ कोलेस्ट्रॉल, देयर इज अ नैरोइंग ऑफ योर कोरोनरी आर्टरी एंड एट द रेस्ट, जब आप रेस्ट में हो, जब आप कोई काम नहीं कर रहे हो, उस टाइम पे आपका हार्ट नॉर्मली बीट करता है, एंड एट दैट टाइम this blocked artery is also able to supply the blood to heart. Now if you are doing some exercise, if you are running, at that time your heart is beating more faster as compared to rest, so at that time your heart needs some more blood supply. Now at this time blocked coronary artery is not able to supply the sufficient amount of blood to your heart, and at that time you will suffer from anginal pain. Okay? So it is known as a exertional angina. It is produced by physical exercise, unusual physical exercise और इमोशनल स्टेटस। जैसे मैंने बोला है कि मैं तेरे बिना जी नहीं सकता, ठीक है, दिल मेरा किसी ने इसे तोड़ा, बर्बादी की तड़प लेके मोड़ा, अगर ऐसा कोई सीन है आपका, सो इन दैट केस यू आर इमोशनली हैविंग इमोशनल शॉक, सो इन दैट टाइम आल्सो योर कोरोनरी आर्टरी में constrict, you will have spasm of coronary artery, so you may suffer from anginal pain. This pain can be relieved or it can be removed by rest or by using nitrates. Nitrates means they are vasodilators. Now there is a definite cause for this angina. So there is a EST wave depression in the ECG. आपका जो ECG होता है उसमें EST, PQRST जो wave होता है, so out of that last wave जो होता है EST, so that is depressed in the ECG, and there is a severe arteriosclerotic affliction of the large coronary artery. Coronary artery में आपके क्या है, ब्लॉकेज है. There is a arteriosclerotic plaque in the coronary artery. That is the most reason behind the classical angina, stable angina. Second type होता है इसमें variant angina of presmental. It is an uncommon form of angina. So it is not a common form, variant angina or presmental angina. It is also known as vasoplastic angina. Vasoplastic angina at the rest. As you can see, vasoplastic angina at the rest. It is at a rest, characterized by chest pain at rest. आप बैठे हो, आप कोई काम नहीं कर रहे हो, उसमें भी अगर आपको चेस्ट पेन आता है, दैट इज अ वेरिएंट एंजाइना. देयर इज अ ईएसटी वेव इलेवेशन. यहाँ पे डिप्रेशन था, यहाँ पे इलेवेशन मतलब बड़ा हो जाएगा. नाउ थर्ड टाइप ऑफ एंजाइना इज नथिंग बट द अनस्टेबल एंजाइना. अनस्टेबल एंजाइना एंड इट इज ड्यू टू द सेकेंडरी टू द सम डिसीज. इट इंक्लूड्स वैरायटी ऑफ chronic unstable angina after myocardial infarction, and it is mainly due to arteriosclerotic plaque in the coronary vessel. Occasionally it can be associated with the coronary vasospasm, so that is known as unstable angina. We'll see the drugs used in the treatment of angina. So you know that why there is anginal pain. anginal pain क्यों हो रहा है? क्योंकि आपका किसी न किसी रीजन के कारण आपके हार्ट को ब्लड सप्लाई कम हो रहा है, क्योंकि वहां पे कोरोनरी आर्टरी में एक तो क्या हो गया, ब्लॉकेज हो गया, डिपोजिशन हो गया कोलेस्ट्रॉल का, या फिर आपका कोरोनरी आर्टरी स्पाज्म हो गया, कोरोनरी आर्टरी कंस्ट्रिक्ट हो गया. व्हाट शुड बी योर एम? आपका एम क्या होना चाहिए? बिकॉज देयर इज अ इंक्रीज डिमांड ऑफ मायोकार्डियल ऑक्सीजन एंड देयर इज अ डिक्रीज सप्लाई ऑफ ब्लड. दैट्स व्हाई यू आर सफरिंग फ्रॉम एंजाइना. योर एम शुड बी टू डायलेट द कोरोनरी blood vessel. First aim should be to dilate the coronary blood vessel. Second aim, if there is any arteriosclerotic plaque, you have to remove that plaque. Now, drugs used in the angina. So mostly vasodilator drugs, they are used in the angina pectoris. So first one is organic nitrates. Organic nitrates like nitroglycerin, isosorbide dinitrate, etc. So they are used for the treatment as well as prophylaxis. Prophylactic मतलब क्या है? Prophylactic means prevention, right? And treatment is to correct the symptoms, right? So organic nitrates, they are used for the relief during the attack. So if you are suffering from anginal pain, so organic nitrates will decrease your pain. So they are the drug of choice. Nitroglycerin is a drug of choice in acute anginal pain. You have to remember, nitroglycerin is a drug of choice in case of acute anginal pain. Second type आता है इसमें calcium channel blockers. Calcium channel blockers, they are also vasodilators and they are used for the prophylaxis. Always used for the prophylaxis means prevention. Now third category in that you have beta blockers. So they will reduce the effort of your heart. They will reduce the workload of heart. So almost they are also used for the prophylaxis. Now different classes of drugs used in the angina pectoris. First one, nothing but the nitrates or vasodilators. GTN means nitroglycerin isosorbide dinitrate. Calcium channel blockers, in that you have verapamil, diltiazem. So verapamil is a phenylalkylamine derivative. Diltiazem is nothing but the dibenzodiazepine derivative. In that you have dihydropyrimidines also, dipins, nifedipine, amlodipine, etc. Then beta blockers, in that you have propranolol, atenolol, metoprolol, atenolol. Potassium channel openers, in that you have nicorandil, partial fatty acid oxidase inhibitors. So what is the role of this partial fatty acid oxidase inhibitor? Names of the trimetazidine and ranolazine. Trimetazidine and ranolazine, they are a PHOX inhibitor, partial fatty acid oxidase inhibitor. देखो आपका हार्ट जो है उसको एनर्जी लगता है. Energy is supplied in the form of ATP by the glucose. So glucose is the most reliable source of energy for your heart. If there is a less energy, so in that condition your heart also utilizes the fatty acids. It causes the fatty acid oxidation and it will biosynthesize glucose from fatty acids. Now due to oxidation of fatty acids, there are release of free radicals. तो ऑक्सीडेशन जब होता है फैटी एसिड का, तो उसमें फ्री रेडिकल्स वगैरह जनरेट होते हैं एंड दैट फ्री रेडिकल्स कैन कॉज further damage to your heart. So that's why partial fatty acid oxidase inhibitors like trimetazidine, ranolazine, they are used to prevent the further complication, to prevent the further damage in the angina. Okay. Now sodium channel blockers like ranolazine and ivabradine, these are the new drug also used in the angina. We'll see it again. Anti-anginal drug. So there are different category of drug used in the angina. First one is nothing but the nitrates. They will dilate the blood vessel. So you have short acting and long acting. So short acting glyceryl trinitrate, isosorbide dinitrate. Isosorbide dinitrate, if it is given by sublingual route, it will act as a short acting. Long acting isosorbide dinitrate, if it is given by oral route, is a long acting. This was also question in GPAT. Long acting nitroglycerin derivative. So isosorbide dinitrate, isosorbide mononitrate, erythritol tetranitrate, pentaerythritol tetranitrate. These are the long acting nitrates. You have to remember. Okay. Then beta blockers, in the metoprolol, propranolol, atenolol. Then calcium channel blockers, in the you have verapamil, diltiazem, amlodipine, nitratine. Our verapamil is nothing but the phenylalkylamine derivative. Diltiazem is a dibenzodiazepine derivative. Amlodipine is a dihydropyrimidine derivative. Okay. Nicorandil, potassium channel opener, is a nicorandil. Okay. And other drugs, trimetazidine, ranolazine, both are nothing but the partial fatty acid oxidase inhibitor. Ivabradine, oxyphenadrine, and dipredam. So these are the drugs used in the treatment of angina. You have to remember this. It is very important. Okay. Now we'll see drugs used in the treatment of congestive cardiac failure. So basically congestive cardiac failure होता क्या है आपको मालूम होना चाहिए. What is the congestive cardiac failure? So if your heart is not able to provide a sufficient cardiac output, if your heart is not able to pump the blood, sufficient blood, that is known as a heart failure. So failing heart is characterized by inability to provide a sufficient cardiac output for the body's metabolic demands or needs. So if cardiac output is decreased by 40%, so if cardiac output is less than 40%, then you can say your heart is under failure. So heart failure is characterized by if there is a decreased cardiac output up to 40% failing heart. Okay, your heart failure is nothing but the failure of heart to pump the blood, mostly from left ventricle. And you have to remember, most accurate measurement of cardiac output is nothing but the left ventricular ejection fraction, left LVEF. Left ventricular ejection fraction is the most reliable determinant of cardiac output. Now, heart failure is because of the different reason. It may be due to pressure overload, volume overload. Pressure overload means, as in case of hypertension or stenosis of cardiac wall. Stenosis मतलब बंद होना, कार्डियक वॉल अगर आपका ब्लॉक हो गया तो उसमें प्रेशर ओवरलोड होता है हार्ट के ऊपर, एंड दैट्स व्हाई हार्ट इज नॉट एबल टू पंप द ब्लड सफिशिएंटली. वॉल्यूम ओवरलोड मतलब इन केस ऑफ कंजेनाइटल हार्ट डिसीज, रिकरेंट लेशंस ऑफ मिट्रल वॉल एंड एओर्टिक वॉल, तो उसमें भी क्या होता है, वॉल्यूम बहुत ज्यादा होता है ब्लड का हार्ट में, सो इट इज नॉट एबल टू पंप द सफिशिएंट वॉल्यूम ऑफ ब्लड. देन लॉस ऑफ कार्डियक मसल, अगर आपको मायोकार्डियल इंफेक्शन है, इश्यमिक हार्ट डिसीज है, so in that your myocardial muscle is lost, and due to that loss your heart is not able to pump the blood effectively. Then again, decreased contractility. So due to myocardial infection of myocarditis, decreased contractility, restricted cardiac breathing, as in case of constructive pericarditism, that is known as diastolic heart failure. So heart failure may be a systolic heart failure, diastolic heart failure. Systolic heart failure means if heart is not able to pump the sufficient blood, that is a systolic heart failure. Diastolic heart failure means body's metabolic demand is increased, and that is not, if your heart is not able to supply that amount of blood, that is known as a diastolic heart failure. Okay, now if there is a decreased cardiac output, there is a compensatory mechanism of your body, कि अगर आपका cardiac output कम हो चुका है तो आपकी बॉडी उसके अगेंस्ट में एक मैकेनिज्म होता है, compensatory mechanism, to compensate decrease the cardiac output, it will increase the sympathetic outflow. क्या होगा, adrenergic nervous system का activation हो जाएगा. So there will be arterial stage activation of renin, angiotensin, aldosterone system. Okay, that increases that further tries to increase the cardiac output, but that is transient. एक short time के लिए cardiac output increase होगा आपका, बाद में क्या होगा, हार्ट का रीमोल्डिंग होगा. रीमोल्डिंग, हार्ट का रीमोल्डिंग मतलब हार्ट का साइज बढ़ जाएगा, and due to improper contraction, and due to if heart is not able to provide sufficient cardiac output, that means heart is not able to pump forcefully. So what will happen, so fluid will be retained on your lungs, fluid will be retained in your lungs and tissues. तो जब आप हार्ट आपका फोर्सफुली कॉन्टैक्ट नहीं हो रहा है तो जो ब्लड फ्लूइड है वो जमा हो जाएगा आपका लंग्स में, आपके टिश्यूज में, तो आपको एडिमा हो जाएगा, पल्मोनरी एडिमा और जनरलाइज्ड एडिमा. सो दैट्स व्हाई हार्ट में क्या हो रहा है कि बहुत सारा ब्लड जमा हो रहा है, लेकिन हार्ट में उतना प्रॉपर फोर्सफुली कॉन्ट्रैक्शन नहीं होने के कारण थ्रो नहीं हो रहा है, ब्लड इजेक्ट नहीं हो रहा है. तो लेफ्ट वेंट्रिकुलर इजेक्शन फ्रैक्शन इज लेस. यू कैन सी acute heart failure, it may be either acute heart failure or chronic heart failure. So in case of acute heart failure में क्या होता है, so decreased contractility of your heart. So as there is a decreased contractility of your heart, decreased the blood pressure, so it will be monitored by your baroreceptors. It will stimulate adrenergic nervous system. In case of acute heart failure, आपका हार्ट अगर फेल हो रहा है तो कॉन्ट्रैक्टिलिटी उसका डिक्रीज हो जाएगा और वो मैसेज आएगा आपकी ब्रेन को, एंड कंपेंसेशन और कंपेंसेटरी मैकेनिज्म एक्टिवेट हो जाएगी, तो सिंपैथेटिक आउटफ्लो बढ़ेगा, मतलब एड्रेनर्जिक नर्वस सिस्टम का स्टिमुलेशन होगा. वहां से जो नॉरएड्रेनालिन आएगा यहाँ से, सो ये नॉरएड्रेनालिन अल्फा रिसेप्टर के ऊपर एक्ट होगा. इट विल स्टिमुलेट द vasoconstriction, it will cause vasoconstriction which increases the preload on the heart. vasoconstriction हो गया तो जो प्रीलोड है, वेनस रिटर्न जो है वो आ जाएगा हार्ट में, दैट इज नॉट एज अ प्रीलोड. और अल्फा रिसेप्टर ड्यू टू कंस्ट्रक्शन ऑफ आर्टरीज, ये आर्टरीज का कंस्ट्रक्शन करने के बाद में उसका कारण अपर लोड बढ़ जाएगा. सो प्रीलोड एंड अपर लोड. व्हाट इज प्रीलोड? सो व्हाटएवर वेनस ब्लड दैट इज कमिंग टू योर हार्ट, जो वेन में का जो ब्लड हार्ट में आ रहा है, आर्टरियोल्स में, दैट इज अ प्रीलोड. और जो आपका लेफ्ट वेंट्रिकल में जो ब्लड है उसको बोलेंगे अपर लोड. कॉम्पेंसेटरी मैकेनिज्म इंक्रीजेस द प्रीलोड एंड अपर लोड बाय एक्टिवेटिंग और स्टिमुलेटिंग द अल्फा रिसेप्टर. It also stimulates the beta 1 receptor in the heart, which increases the heart rate and force of contraction, which try to maintain the cardiac control. Also stimulate the beta 1 of your kidney, which causes activation of renin. So it will convert angiotensin chain to angiotensin 1, and angiotensin 1 will become 2 by the ACE. Angiotensin second is a vasoconstrictor. It will again increase the preload and afterload. It will increase the preload and afterload by doing vasoconstriction. It will also stimulate the aldosterone to increase the salt and water retention, which will increase the which will increase the volume of blood, which will again cause congestion in your heart. Due to this, what will happen? Your left ventricle may left ventricle will receive the more blood. So due to this compensatory mechanism, आपका हार्ट में ब्लड बहुत ज्यादा आ जाएगा, ठीक है। और ब्लड ज्यादा आने के कारण आपका हार्ट में क्या है कि हार्ट इज नॉट एबल टू पंप द ब्लड फोर्सफुली, तो आपके हार्ट में ब्लड जमा हो जाएगा, कंजेशन हो जाएगा। तो वहां पे क्या होगा, आपका जो मायोकार्डियल मसल्स है वो रिलैक्स हो जाएगा, डायलेट हो जाएगा और डिस्टेंस हो जाएगा, so your heart size will increase. So that is known as a remodeling and to that death. Now in this condition you can use different kind of bloods, different kind of drugs. So you can use alpha blockers, which will decrease the preload and afterload. You can use vasodilators like nitrate, which can decrease the preload. You can decrease afterload by using arteriolar dilators. You can use beta blockers. You also can use ACE inhibitors, angiotensin receptor blockers, aldosterone antagonist, and use diuretics. So most commonly used drug is nothing but the diuretics. In that also you have loop diuretics. So furosemide, ethaconic acid, they are mostly used in case of heart failure to reduce the edema and congestion, right? Now we'll see the drugs used in the cardiac failure. Drugs for congestive cardiac failure. So what will be the your aim in the congestive cardiac failure? Congestive cardiac failure में आपका हार्ट जो है वो पंप नहीं कर पा रहा है फोर्सफुली, तो ऑब्वियसली उसमें क्या करना चाहिए? सो यू हैव टू use inotropic drug, inotropic or inotropic drug. So these drug will increase the force of contraction. These drug will increase the force of contraction. So in that you have three kind of drug. Inotropic drugs, the first category, inotropic drugs. In that you have cardiac glycosides like digoxin, aubergine, digoxin. Cardiac glycosides, they will increase the force of contraction. They are nothing but the sodium potassium ATPase inhibitors, right? Remember. Now sympathomimetics or sympathomimetic inotropic. So dopamine and dopamine, they will increase the force of contraction. Then phosphodiesterase 3 inhibitor. You have to remember, इसके ऊपर क्वेश्चन आ चुका है. Which one is the phosphodiesterase 3 inhibitor? Enamrenone, milrenone. Enamrenone and milrenone is nothing but the phosphodiesterase 3 inhibitor. So they will inhibit the phosphodiesterase enzyme, will increase the intracellular cyclic AMP level, which is very important to cause the contraction of your myocardium. Now ये हो गया first class. Second class, renin angiotensin receptor, renin angiotensin inhibitors. So in that you have ACE inhibitors like ramipril, enalapril and others. 81 receptor blockers like sartans, losartan, candesartan. Then diuretics. In the diuretics you have high ceiling diuretics or loop diuretics like furosemide, bumetanide, torsemide, etc. Thiazide like diuretics, hydrochlorothiazide, metolazone, zipamide, indapamide. Vasodilators, in that you have glycerol, trinitrate, isosorbide dinitrate, arteriolar dilator like hydralazine, and arterio plus venodilator, sodium nitroprusside. Also, and beta adrenergic blocking agent, metoprolol, bisoprolol, nebivolol, carvedilol. So metoprolol is known as a prototype for cardioselective beta blocker. You have to remember. Bisoprolol is a highly cardioselective beta 1 blocker. Nebivolol is a beta blocker with a nitric oxide releasing property. Carvedilol is nothing but the beta blocker with additional alpha blocking activity. And last class आता है aldosterone antagonist. In that you have spironolactone and iprelenone. You can order this magic bullet for GPAT Niper DI Pharmacist. Read 2-3 times before exam and qualify 100% with very good rank. You can order from this number. This is my WhatsApp number. You can WhatsApp me for sample PDF and order. You can also join our GPAT Niper 2024-25 online crash course. Here we will have live lectures, recorded lectures, study material, online test series. Everything is in 8,000. You can see we have very much promising results from past few years. Thousands of students they are placed in the Niper.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100